Opioid agonist treatment is an evidence-based therapy for treating people with opioid use disorder. So basically what it is we've found that the way to treat people who use opioids is to give them a steady dose of an opioid. And when I can go and I can get a measured, reliable, steady dose of an opioid medication in my system, it allows me to have some stability in my life. And then I can tackle things like housing and employment and my psychosocial economic spheres of my life. I'm a person who uses opioids. I got involved with them when a dentist gave me a prescription for Percocets back when I was like 16 or 17. Pretty early in my early 20s, I was accessing street drugs, and when that became untenable, I got to a point where I sought treatment from a doctor. And I've used a lot of different formulas of OAT over the years.
I used because I wanted to not ever feel. I didn't want to feel, I just didn't want to be acknowledged in the world kind of thing, right? And take all the pain away, the hurt, anything that, I don't know, just one day all of a sudden I clicked after a while and I'm like, I want to stop using because I have a great kid and family and friends and stuff like that. But I got to the doctor's office and I said, look, I'm an opiate user and I want to quit, so what can I use? And they recommended methadone.
There's a lot of different kinds of medications for opioid agonist treatment, and it's what works best for the person. So there's something called Suboxone, which is a once a day tablet that we can take. There's methadone, and there's also Cadian, which is a long-acting morphine that's available once a day. And it's up to me, and that's been my experience with OAT at Interior Health, has been that I went to my doctor and they really met me where I was at and asked me what I wanted to do, and we went from there and we came up with a plan together. So I had that component of self-determination and that I was in control of my treatment.
But you got to take that step, and if you want to have a life, and if you want to be happy, you're not going to be happy when you're using. You're going to be happy when you get off of it, taking the OAT program, and then maybe a little exercise, things that you need to do to work with you to keep you off. But you will be better. You will have a better life. You'll feel better, and yeah, you can do it.